Hello, I'm Sita Soni, one of the solicitors at Boys Turner's medical negligence claim. Today I'm talking to Sophie Lesser, who's a case manager, about her experience specifically helping clients with a spinal injury. Hi Sophie, thank you for talking to us today. Would you like to introduce yourself and tell us a little bit about your background?
Absolutely. So I'm Sophie and I am a case manager working for Independent Living Solutions. I've been working for them for about 6 years. Previous to that, I was working as a spinal occupational therapist in one of the spinal units in the Southwest and worked there for about 10, 12 years working with a range of spinal cord injured patients from really incomplete right through to completely ventilated.
Sounds like that experience really helps you then on a day-to-day basis with helping the clients who have a spinal injury.
Yeah, it does. It gives such a great background and basis to work from in terms of clinical knowledge and experience of that inpatient setting and how that then might translate into being out there, being out of hospital and in the community.
So in your words, what would you say a good case manager does?
I think a good case manager listens to you, to the client, listens and takes the time to really understand what makes that person tick, what's important to them, and what that looks like when they're at home, and how they want what makes them into their normal everyday life. I also think a good case manager advocates for their client as well. So really supports them in trying to work towards what it is they want and where they want to be with their life.
Sounds like sort of good communication is really key then.
It is, absolutely. And again, I think it's about a good case manager will take the time to get to know you and get to know those facts before really forging ahead with case management. It's a vital part of understanding what you're working with.
And for somebody with a spinal injury, why do you think it's important to have a case manager on board? What can the case manager do for that client?
I think case management is a really umbrella term in many respects, but it really does help that person. It's about coordination. It's about seeking out opportunities and seeking out solutions for someone. For example, it might be that person is desperate to go on holiday again. And actually, as a case manager, the role is about helping them do that, looking for how is that possible, what do they need in place, and coordinating that and supporting them in doing that. I mean, and it really can massively help someone move forwards, having someone just to coordinate and signpost and advise in the background.
I can imagine the whole process can be quite overwhelming, quite daunting for a client, especially they're maybe immediately post-injury, or even if they've had the injury for quite a while and perhaps they haven't had much support. I can imagine it'd be quite maybe a bit daunting, a bit isolating for them. So having somebody who could bring it all together, I can imagine being really, really helpful, just taking the burden off that person and perhaps even their family as well.
Absolutely. And I think that's a really key point actually for people who have had a life-changing event, and actually just having that person who can help with some of the simple things as well as the complicated things is massive for them.
So in terms of what types of support and arrangements that a case manager could perhaps help put in place for somebody who's had a spinal injury, what are the kinds of things? Can you give us some examples perhaps of something you might be able to help with?
Absolutely. So again, it's a large range of things, but some of those things might be about care. Does someone need support? What kind of support do they need? What does that look like? And getting that organised for someone. Rehabilitation, so they might need a little bit of extra physio, occupational therapy. It might be that we need psychology, speech therapy, and those are key people that we can organise for a client. But it's also it might be about supporting the family, and so domestic support. It might be helping someone get back to those hobbies that actually they love. So horse riding, for example, or holidays, or yoga, motorcycling, those things that make that individual tick as a person and looking at what those options are. Property as well. It may be that we need to be looking at property, any changes to the house, a different house, or maybe equipment that would really benefit the individual. So standing frames, splints, kitchen adaptations to make their life a bit easier.
I can imagine with equipment that there's obviously such a range of equipment that's out on the market. And I mean, where would you even start with that if I was on my own trying to look for things that I think might help me? And obviously these things can be expensive. It must be quite a difficult task really going through it. I think obviously a case manager there would be really important, just finding what's right for that person and maybe doing some demos. Is that?
Yes, so I think it depends what the equipment is. But I think that's where sometimes that knowledge of spinal injuries works really well, because you've got that basis of knowledge from all of that background knowledge and experience. But it is looking at breaking it down, looking at what do you need? What do you need it to do for you? And absolutely looking at different products, demonstrations, but also linking in, if you've got a therapy team around you, for example, a physiotherapist, linking in with that person as well, using their knowledge to link it in together to make sure it really is the right piece of equipment, but also looking at a range of equipments to make sure that we are getting the right thing for you and that you're going to use it, because that's really the key. Is it user friendly?
Last thing you want is a piece of equipment that's just sat in the corner not being used. It's
absolutely, and sometimes it is about being creative. So we know that product A might be the best solution, but actually it's not because of a particular reason. And actually we need to be creative looking at that to try and make it the best solution possible.
And you mentioned rehab. What are some of the issues that you might see for somebody who's just had an injury, they're discharged into the community? What's community rehab like? What are some of the issues that you might see, perhaps even before you get involved or as you're getting involved in the case?
I think it's very, it's obviously dependent on someone's level of injury and what they need, but sometimes there are waiting lists for community rehab. Sometimes that service is perhaps time dependent. So the service is not something that can continue long term for that person. And so from accessing therapy can be a little bit challenging for people. I think expectations around what can be provided as well is quite often a challenge to work through as well. And looking at what's the best way to provide that. Is it accessing community services, or is it looking at a different option, perhaps private related therapies that might have a more scope and more ability to provide for longer term for that person?
So we talked about different therapists and perhaps medical input, and how important is sort of a multidisciplinary approach then for that client? You've also got lots of different people that might be involved in trying to help. Obviously that can probably be quite a lot going on. Is a case manager's role to trying to bring that all together for the client?
Very much so. And working with a multidisciplinary team with someone is really key, and utilising all of that expertise in the team. So bringing it together, coordinating it, but also making sure that it's the right therapist for the client as well, because a little bit like a case manager, if you perhaps haven't got the right therapist working with you, communication might not be there, and it cannot perhaps be an easy process. So finding the right people with the right experience, but also coordinating it together. And it might be that having quite regular team meetings with that multidisciplinary team and the client are really key to ensure that everyone's pulling together and working on the same goals. And there's no duplication, and actually we are all talking to each other about what we're trying to achieve for the client, because ultimately that's what we're striving to do really, is work for the client with their goals and improving their quality of life.
And how important is the timing of rehab for somebody who's just had an injury compared to somebody who's maybe a little bit way down the line?
It's quite a difficult question to answer, but I would say the timing is quite crucial. for both of those. For someone who's just been discharged, perhaps from a hospital environment, I think having that follow-up therapy is really key to be done quite quickly, because they've come through rehab, they've made lots of good progress, and we want to maximise that progress even more in the community. So the timing is really key. But also, if there is perhaps a very long gap, actually there is a chance that client could perhaps lose some of that progress, and possibly maybe some complications as a result of not having that therapy. So the timing is really key for people who perhaps have been discharged for a long time. Perhaps again, it's about the timing is a little bit more difficult, but it is about getting the right people involved to then look at what the issues might be then, and promptly working with that person to try and create a difference for them.
This is a balance of somebody who's just had an injury of rest and recovery, but also challenging them to achieve the best that they can.
It is, and I think that balance is really crucial for people. So it's really easy to have lots and lots of rehabilitation, and that is very key for someone, but it is also just as important to get that balance of rest and allow yourself to recuperate and sleep and manage any other, for example, maybe pain or fatigue, lots of tiredness, to be able to continue with your rehab. So it is a balancing act for a lot of clients, and sometimes you have to just explore that balance as part of case management.
Okay. What are some of the main challenges that you feel that some of your clients face following a spinal injury, whether it be sort of the psychological impact, perhaps? How does that affect them?
I think it depends on the individual and their perceptions and outlook on their life, but psychologically, coming into the community, I think that is a big issue for certainly a lot of people that I've worked with. It's a big issue, having access to psychology services, but also having that time to work through the sheer implications of just what's happened to them and what that might mean for their life and their family and work and all of the things that we take every day for granted. And having that really good access to psychology is key.
And presumably that's something as a case manager you could help put in place for the client.
Absolutely. So it could be psychology. It might be that counselling might be more appropriate. But again, it's spending that time with the person you're working with to understand what they need.
Yeah.
I think one of the other challenges for people when they are in the community is the more unseen aspects, which might be pain and sleep, fatigue, which all dovetail together for someone. So for example, if we don't sleep, we don't function very well. And it is about, again, those are unseen things that actually sometimes for people who have come out of a very busy, active rehab inpatient stay, and you start working with them as a case manager, those are quite often key issues for people, along with routine and kind of daily structure, really key issues as a case manager you can see for someone that actually they need some support, perhaps re-establishing these things which we take for granted.
And perhaps in some situations, peer support can be quite helpful, with perhaps putting them in touch with charity organisations who might have support groups and things like that. Do you find that those are quite useful for clients?
Yes, and there's some really good peer support around. The Spinal Injuries Association and the Backup Trust are just two to mention. They both offer peer support and mentoring services. Again, really key for people because the mentors, the peer support, they've had spinal injuries themselves and they've perhaps come through that rehab process and experienced some of the things that people are going through. And they also, there's also a family service offered via the Backup Trust as well, which again provides support to the family members, perhaps of that individual who's had a spinal cord injury. And again, that's really valuable to just allow that person a different way of having support from someone who's experienced it.
Yeah. And in terms of after, when a client is discharged after an injury, do you see that there are lots of other associated injuries that might be challenging for them, but perhaps bowel difficulties or bladder difficulties that also need some support and management with those aspects?
Yes, and I think quite often, certainly bladder and bowels, whilst are very, very well managed in the community, they can sometimes be difficulties. Perhaps someone's bladder changes a little bit due to spasms, which can cause perhaps some leakage with the bladder, but also how that bladder is managed, and certainly the bowels around timings and care and daily life. So again, it's a theme that pulls through with a lot of the people I work with, just looking at how that fits for them into their daily life.
And of course, because they're quite personal issues as well, so it can be quite, I imagine, quite daunting, and perhaps people don't want to talk about them, but actually there's still challenges that they still need support with.
They do, and I think part of with bowels and bladder, I think they're talked about so much when you're particularly in a spinal unit, about how your bowels and bladders are managed, that actually for the individual sometimes that's part of the normal conversation. But absolutely, they're very personal issues to deal with, and again, I think it comes back to that beginning part. If you've spent the time getting to know that client, actually talking to them about some of the more intimate details like bladder, bowels and sexual function, that becomes just a little bit easier because you've spent that time at the beginning getting to know them.
Definitely. And then just moving to perhaps equipment and some of the issues surrounding that, do you find that there are difficulties sometimes accessing equipment? And how does a case manager fit in with that?
So there are some difficulties with equipment, and it depends if you're going to access the equipment through perhaps local services, so wheelchair services, clinical commissioning groups, and the time frames that are associated with getting that equipment. And that can be a challenge for people because perhaps the time frame is 6, 8, 12 weeks, which actually for someone who perhaps needs to stand and doesn't have a standing frame, or perhaps their wheelchair just doesn't completely meet their needs, that's a long time to wait. And so as a case manager, we can link in with these local services, but we can also support that person to consider, do we want to look at this a different way? Do we want to pay for it privately? Do we want to make a case to look at it from a private perspective rather than a local statutory perspective?
And I guess it's all probably quite draining for a client to have to deal with all the local authorities and any funding issues and things like that, and where actually you want people want to focus on their own rehab, and I guess that the case manager can take that unnecessary and additional stress from them and take those roles over, whether it's chasing people or anything like that.
Yeah, and again, I think that comes right back to the beginning, where actually you can help the client understand how that works. But yes, taking that load, that burden off the client to actually not have to worry about those aspects, very much so, is really key.
Yeah. So based on your experience with helping clients with spinal injuries, what are some of the most frequently asked questions that people might have for you?
Questions around particularly therapy provision, particularly physiotherapy. So asking about what's provided, what's possible. Questions around prognosis and progress, which quite often ties hand in hand with the rehab aspects as well. So those are quite often frequently asked questions. And I think probably one of the questions that is asked quite a lot is around things like the more intimate details, like sexual function, because I think that's particularly that issue. It's not always discussed openly, as particularly in a hospital environment where actually the focus is about the physical aspects of rehab and discharge planning. And I do think some of those issues are perhaps not dealt with in their fullest in those situations. So again, it's the questions around sexual functioning, possibly bladder and bowels, but particularly the sexual functioning.
I think it just really highlights why having the right case manager on board is so important at the outset, but also somebody who has that specialist knowledge and experience to know all the different aspects that the client might be having challenges with.
Absolutely. And I think it's also about, if you maybe don't quite know the answer, actually it's, where you can access the information, be it through the spinal unit. You can actually support the client by having those discussions and finding that information out, because the fields are changing all the time and there's always new learning. As a case manager, there's always something new to learn that can benefit the client.
Do you have perhaps a case study or a client story that you'd like to share, where it shows where case management has been really useful, helpful to the client? If there's somebody that you'd like to talk about?
So I think this is an incomplete injury. This client is able to walk. And I think she has, like most people who have had a spinal cord injury, she's had quite a bumpy ride from her injury through her spinal unit rehab and then out into her local back home. And I think this is a person who was able to, get herself up, get herself self-dressed in the mornings, and manage some of the more day-to-day aspects. But where case management has been really beneficial for this person is around her sleep, her pain, her daily routine, and her ability to go out of her apartment. So those are all areas that we take for granted. But this is a client who didn't sleep well, perhaps didn't go to sleep until 3 a.m. in the morning, then slept late the next day, then found it very difficult to function during the day because she was so tired during the day, but she was so determined to progress with her injury that actually she would push herself every single day and would then get to a point which she'd crash and burn, basically, which means that she's so tired, she just can't function. She just has to go to sleep, and she might sleep for a 12, 18-hour period. So a pattern that's very habitual that is quite unhealthy, because what it does is she's not sleeping, but her pain also very, very poor, which is one of the reasons she's not sleeping, very poor at night time. And her fatigue is absolutely incredible for her, because she then can't do what she normally does, which is get herself out of bed, get herself washed and dressed, go to her physiotherapy. So it really impacted on her daily life. So as a case manager, we broke that down into different segments, and with her therapy team, which consisted of a physiotherapist, an occupational therapist, and a psychologist, we worked together to set very specific goals for her around her sleep. So they were really small. For example, to go to bed at between 10 p.m. and 12 p.m. every night, but a small goal that's very achievable for her. We put in a goal around napping, so giving her permission to nap every day, perhaps no more than 90 minutes, but every day, to stop that crash and burn situation. And then for her pain, we got her a really good pain consultant to really, really review her pain medication and look at what was happening with her pain, what was triggering it. Was there perhaps a better way to manage her nighttime pain with a change in her medications? It's been quite a long process for her, but actually the end result is such lovely progress. She's now sleeping much better at night. She's going to bed at a regular time. She's waking up at a regular time. She's still having that nap in the afternoon, and that means she's actually quite functional during the day. And we've now actually started to introduce more stress on her emotional and mental capacity as well. So, and what I mean by that is what happens when we start to challenge her to think more by doing an online course. What does that do to her fatigue? So thinking about some of those preparations for going back to work. how does she function then? What impact does that have on her pain and her fatigue? But she's now much more functional, got a much healthier sleep routine. Her pain is better managed at night time, which means she's sleeping. Her fatigue is better managed. And she's now starting to go out of her apartment more because she can function. And those things sound quite small, but actually it's had a really, really big effect on her quality of life and her ability to think about what her life might look like in the future.
No, that sounds amazing. It shows how sort of vital small steps are to reach that bigger goal. Can be really...
And I'd always recommend break it down because these tasks, they can seem enormous to someone who is in the moment and you have a spinal cord injury and you can't see how you can change things. Absolutely, just break it down. Small, achievable goals with the support of your case manager and your rehab team, and it is achievable.
I can imagine it just all seems a whole lot less daunting than with that support.
Absolutely. With those steps. It's that sounding board and that additional advice and support that can sometimes make a difference between achieving it and not achieving it.
Oh, yes. So we've obviously had quite a difficult year this year. What have been some of the challenges that you have been experiencing in supporting your clients with spinal injuries with COVID-19?
A couple of issues have been really key. One is for those clients who perhaps have had a care team involved, and actually keeping that care team actively working with that client safely, but also managing the anxiety that I think COVID has brought along, because particularly at the beginning, we didn't understand it very well. That created an awful lot of anxiety for an awful lot of people. So managing that anxiety and supporting the care teams and supporting the client in keeping the care in place. And that's been a really key thing. But the other aspect we discovered because of COVID was the access to therapy and access to perhaps those appointments and those clinic appointments. So we went through a period where the majority of therapy was stopped because of the national lockdown. But now it's looking at the restrictions and access, and particularly clinic appointments. The waiting lists are slightly longer now because lots of clinics are halving their appointments to manage all of the restrictions with COVID. And I think there's going to be a long-lasting mental health effect for a lot of people, but also particularly when you work with someone with a spinal cord injury who might be isolated as a result of their injury, that has a bigger effect. So again, it's just looking at what does this mean now for people and how can we support them better as a result of COVID.
And I guess we're quite fortunate to have some of the technology that we have now for Zoom calls and FaceTime, that some support can continue and some therapies can continue. It might not be as great as a face-to-face support, but at least there's something that's still going on really to keep the client pushing themselves and moving forward. And
I think some of my clients have had virtual therapy as well during this time, which has been interesting. But it's been a way of keeping some contact, keeping some face-to-face contact, and keeping some aspects moving forwards for people.
So do you have any tips in picking the right case manager for a client who has had a spinal injury?
I would say take your time in choosing your case manager, and don't be afraid to ask questions around their experience as a case manager, but also their experience in spinal injuries. And some case management companies offer the ability to meet someone first before you make that decision. I would highly recommend that, purely because it gives you that opportunity to kind of sound and feel that person out. Do you want to work with them? Do you like them? Do they make you feel confident? They're really key aspects for me. So I would absolutely recommend just taking your time in choosing your case manager.
It sounds like the relationship between case manager and client is really important. It's important to have somebody that you can you can trust and that you can work with to achieve the best that you can and to achieve what you want out of your life.
Absolutely. And I think I would also say if you have the opportunity to meet several case managers beforehand, if you don't have a good feeling about them, don't be afraid to say thank you, but no thank you, because that relationship is really important.
I thought we could end with some of the maybe the most rewarding aspects for you of being a case manager, working with clients with a spinal injury.
I think the most rewarding thing about being a case manager is that you meet the most incredible people who have come through some incredible experiences with their spinal cord injury. And I often feel that as a case manager, you're in a very privileged position because you are working with someone and helping them achieve their own goals that are really personal to them, and they are able to trust you with them and allow you to help them. And so I feel that that's a very privileged place to be as a case manager. And I think it is always rewarding to see someone you're working with achieve that goal. And it might be a goal that is really small, like sleeping through the night, for example, but it might also be something big, like they've gone on a holiday to, I don't know, the United States, for example, which is something maybe when they first had their injury, they just didn't think would be possible. But actually, with the right support around them, you've helped them achieve that. And that's amazing as a case manager to be able to help someone do that.
No, I can definitely imagine those small steps making a massive difference to somebody's life and how they feel about themselves. It must be really rewarding. And
it is. It's a lovely job as an occupational therapist with my professional background, but it's brilliant as a case manager because you don't necessarily have maybe you have different boundaries as a case manager. You have more ability to be creative to perhaps find a solution for someone, and that's lovely in itself as well, and is always so rewarding.
It was really nice to talk to you today, Sophie. Thank you for giving us an oversight about case manager's role and your experience in helping clients with spinal injuries. Thank you.
Thank you.